Good afternoon. I am Dr. Shiv Kumar Santpure, practicing since last 23 years at Aurangabad in Maharashtra. Now Aurangabad is renamed as Chhatrapati Sambhajinagar. Yes, with increasing number of joint replacements, we are going to see a lot more revision surgeries. So most common reason for a revision total hip replacement, I would say, is aseptic loosening and leading to a lot of polywear. So in my opinion, most common reason for revision is aseptic loosening of a primary total hip replacement. No, it is quite a different procedure compared to the primary total hip replacement. So first challenge is to remove the implant. Most of the times the cup may come out easily, but it is very challenging to remove the previous stem, which may be cemented or which may be uncemented. In most of the cases, you will be doing a long extended trochanteric osteotomy. So it is a quite different surgery compared to primary total hip replacement. Challenge being the implant removal, and the next challenge is to how do we build the bone. There will be bone loss on the acetabular side, there will be bone loss on the femoral side. So implant removal and building the bone would be the most challenging thing, and that differs it from the primary total hip replacement. So most of our patients coming for THA are relatively young patients, and these newer stems, which combines best of both worlds. Though it is not really a modular stem, but it has got advantages of a modular stem. So a long revision stem and option to have ceramic on ceramic bearing. I think that is the most recent advances which are helping me to do a better revision total hip replacement. Yes, again, as I said, most of my patients are younger active men. Hip is usually younger and active men. And in most of our cases, we use ceramic on poly and ceramic on ceramic. So in last 20 years, none of our patient of ceramic on poly or ceramic on ceramic is yet to come back for a revision. So this is a big thing, I think, when we are dealing with younger patients.